I'm Dr. Larry Edwards, and I'm a specialist in internal medicine and rheumatology, a professor of medicine at the University of Florida, and chairman of the Gout and Uric Acid Education Society. We get our first contact with many gout patients when they come to the doctor because they're having a gout attack. What patients experience during a first or other early attack is certainly not just a mild pain. It's a severe pain with hot, red, very tender, inflamed joint. It often begins in the feet, most commonly at the base of the big toe, but initial attacks can be in many joints in the body. Sometimes primary care doctors will look at this classic picture and tentatively diagnose gout, but to make the definitive diagnosis, a rheumatologist will carefully insert a small needle into the joint to gather a little joint fluid. We will then look at this fluid under a microscope to check for the typical needle-shaped uric acid crystals in the joint. This can confirm the diagnosis of gout. Another test that can help in gout diagnosis and in planning management is to check the level of uric acid in the blood. We usually wait a couple weeks after an attack is over to get an accurate uric acid level. That's because the inflammation of an attack can temporarily lower the uric acid level. Along with the uric acid level, we'll check kidney function, and at that point, we'll begin to discuss long-term management for gout. When it comes to gout diagnosis, it's important to know that any diagnosis is tentative without examination of joint fluid for crystals. Purely clinical diagnoses can be up to 80% accurate, but are not absolute. Gout attacks are extremely painful, and gout can become a very serious problem if not treated properly. It's important to seek accurate diagnoses if you or your loved ones have symptoms of gout. That way you can be put on a treatment plan that will help you manage it.